So, do you know how you even check bone density? Bone density is checked by a special scan called a DEXA scan, and a DEXA scan checks how dense your bones are. Now, osteoporosis is what happens when we lose bone density, but before that, you can get osteopenia, and it's all just basically a sliding scale. If you have a DEXA scan consistently, you can watch your bone density, and I encourage you to watch it, because once you go past 2.5, you are osteoporotic, which means you have brittle snips of bone. If you're under 2.5, let's say you're 2.1, you have osteopenia. When you get to 3, if you get to 3.3, there's no way you're not going to have to do a drug. There's just no way. But there are some good drugs, and sometimes you have to do drugs. But sometimes the typical drugs like Boniva and Fosamax can cause increased joint pain and increased risk of fracture. But there is a drug called Prolia, which some people are a better candidate for Prolia, where it is twice a year you have this drug, and it has less side effects. I have women that I work with to help them form bone density, and it looks like walking. It looks like weightlifting with their arms, because their forearms are more likely to snap. So I'm looking at like good old-fashioned like wall push-ups and bicep curls. It doesn't have to be crazy, but we have to look at, why is your body not absorbing calcium? Are you supplementing? And eventually sometimes you do need to take a medication, because I can't have you having brittle snips of bones. But DEXA scan is the most widely used modality to assess bone density. It is effective. However, there are no standards for how soon a woman should have it. So there's no recommendations on early prevention. So if you are perimenopause, there is nothing. We don't do baselines on women. We wait till you're like postmenopausal or a certain age, and perhaps this is something we can change in the future, because we know in late perimenopause, which is when you start to experience changes in your periods, that your bone density issues exponentially increase. And we want you to know this, because information is power. Because if you're not walking and doing gentle weightlifting, if you're not taking your D, if you don't have adequate calcium supplementation within your diet, girl, you've got to do that now. If you're having period changes, you can save your bones. Save your bones.